Well, good evening, ladies and gentlemen. We are honored that you are with us. My name is Mike McGuire. I'm grateful to work with you as state senator here in Northern California. First and foremost, on behalf of Dr. Brewer and myself, we hope you and your family are doing well during this unprecedented heat wave. We're going to be focusing on the pandemic. We're going to be focusing on Mpox, also known as Monkeypox, here tonight with our community conversation. But I want to assure you, the state of California is mobilizing resources in every corner of this great state, focus on this record-breaking heat wave. It's unprecedented. We haven't seen anything like this in our lifetimes, and want to assure you that we are very focused on making sure that communities up and down this great state have the resources they need to respond. In addition, we're also preparing for significant fire danger. That is why we have pre-positioned bulldozers, fire engines, water tenders, and along with firefighters in 22 counties throughout the state, from San Diego in the south to Mendocino County in the north, ensuring that our communities have the fire protection they need to be able to respond during this record-breaking heat. Now, tonight, we're focused on the pandemic, and we're really grateful that we have Dr. Timothy Brewer here tonight. He's a familiar face here in Northern California. He's one of the state's top infectious disease physicians, and he's been with us since the onset of COVID. He is the trusted voice to provide all of us here in Northern California with the information we need, the accurate and timely information we need, both on COVID and now on the Mpox virus, which we're going to get into talking. Just been informed we have possible. I will be honest with you. We have over 100 questions that have been submitted this evening. We may not get to all of them, but as Dr. Brewer always does, we'll go into a lightning round, trying to be able to get as many questions answered as timely as possible. Tonight, we're going to be talking about just the facts on two critical health challenges that are continuing to impact our communities today: the continued COVID-19 pandemic, as well as the monkeypox, which we're going to refer to as the Mpox virus. Now, make no mistake, COVID is still very much a part of our lives, but thanks to your sacrifice and thanks to a vaccine, we've made incredible progress from where we were 2.5 years ago. Although we can't rule out another rise, COVID cases throughout California have declined over 2/3 from the height of this summer's pandemic high. So that's really good news. The other good news is a new booster shot is going to be available. In fact, we're hearing from several counties today in Northern California, a new booster shot is available, tailored to the most common COVID variants that are active in our communities. Both Pfizer and Moderna will have updated vaccines available. We are hearing from the majority of Northern California counties that they have the vaccine. Some communities like up in Trinity as well as Del Norte, it may arrive tomorrow or first thing next week. But the good news is an updated vaccine is on the way or has already arrived in your neighborhood. And the other bit of good news is the state of California, cities, counties, and school districts continue to be attached at the hip, making sure that local governments and our schools have what they need to continue to combat this pandemic. But just being candid, as we always are with our community conversations, our fight against the Mpox virus has a longer way to go. Now, the Mpox virus has been with us for quite some time. It's actually been with us since the late 1950s. It was first discovered in primates, and then in the early 1970s, the virus was first discovered in humans. Now, some good news. Overall, throughout the United States, we've seen our first leveling off of cases nationwide, but California, because we're the largest state in the union, we continue to have some of the highest number of case counts, and we're going to get into that here this evening with Dr. Brewer. Some advantages that we have in our corner, and I'm going to ask Dr. Brewer to comment on this, some advantages that we have in our corner with the Mpox virus compared to COVID. Number one, Mpox, it's not a new virus. We've known about it for decades. Number two, all in all, it's not as infectious as COVID. As we all know by now, COVID is spread through droplets of saliva and mucus. Mpox is primarily spread through prolonged physical contact, with someone who has the characteristic Mpox rash or lesion, or potentially blood is exchanged, some additional fluids are exchanged, and that's how we're seeing the Mpox virus spread. And we're going to get into that again with Dr. Brewer, who will be in depth in our discussion tonight. And the other big difference that we have between the Mpox virus as well as COVID, we already have an effective vaccine, and that has started to roll out in every corner of this great state. The state of California has declared a state of emergency at the beginning of August on the Mpox virus. This ushers in enhanced federal assistance, especially funding to be able to combat this in big cities and small. And the FDA has approved the microdosing of the Mpox vaccine, which should help alleviate some of the shortage of doses that we had early on in this. Again, Dr. Brewer will get into it. Like I said, we have actually about 137 questions to be exact to get to tonight. We're going to get to as many as possible, but let's get right into our expert. We're going to say thank you so much, Dr. Brewer, for being with us. You have been the voice of reason, the voice of fact. You have been a calming voice for all of us during the pandemic. It is so wonderful to have you back here tonight. We're grateful for your work, sir. We're going to turn it over to you to be able to give us a briefing on COVID, and then you're going to get into the details of the Mpox virus. Dr. Brewer, take it away, and good evening to you.
Well, thank you again, Senator, for having me. I'm really delighted to be here. So where do we stand in COVID? I think the important thing to remember is just that COVID is still with us, right? So in California, we're averaging about 7,000 cases a day. In the country as a whole, we're averaging about 75,000. To put that in perspective, that's higher than any of the case numbers we saw in the first year, 2020, until we hit that first winter surge. So just to remind ourselves that COVID has not gone away. The big difference, as the senator said, though, has been vaccines, right? And so in California as a whole, we have about 78% of our population that's been vaccinated. But where we really need to push it is with the booster doses. And so only about 50% of the population has gotten a booster dose. And as the senator said, there is now a new vaccine. So if you haven't gotten your booster dose, you should get it with the new vaccine. Who's eligible? Anyone who has not been vaccinated within the last 2 months or gotten a booster within their last 2 months and is age 12 or older is eligible to get the new booster. What's the difference? This is a bivalent vaccine. That just means that it has 2 components instead of 1. One is the original spike protein mRNA. So that's exactly the same as what you got before if you've been vaccinated. And then there's a second mRNA coding for the spike protein common to the BA4, BA5 variant of Omicron. And together they account for about 98% of all the COVID circulating in the country right now. So this is a vaccine that's very similar to what you've gotten before. In terms of Mpox is a zoonosis, as the senator said, really actually comes from rodents, but was misnamed monkeypox because the first cases, as the senator said, were associated with exposure to monkeys, but it's actually lives in rodents in Central and West Africa. And what happens is this virus can jump a species barrier, get into people. And we've known about this virus since 1958, and there have been sporadic outbreaks since then. But what's been different since March of this year is a large outbreak that's occurred actually in about 87 countries, involving about 51,000 cases across the globe, about 21,000 cases in the United States, and 4,140 cases in California as of a Tuesday of this week. What's the big difference? The big difference is, as the senator said, this is spread by close physical contact of persons with lesions. And people can be relatively asymptomatic, so they may not be aware that they have lesions. And that's probably helping to facilitate the spread of this virus. However, pretty much everybody develops a rash. So if you look at data from across the United States, 97 to 98% of people eventually develop a rash. About 66% develop fever, malaise, other symptoms like that. Other common findings are sore throat, swollen glands, headache. So those are the kinds of symptoms we tend to see with Mpox. The vast majority of people, this is a relatively mild disease, tends to take about 2 to 4 weeks for the lesions to heal and to go away. So very important, if you do have Mpox, to make sure that you keep those lesions covered and you stay home, isolate yourself until you're all better. And as I said, on average, that takes about 2 to 4 weeks. If you're exposed to somebody with Mpox, and we can talk about what that is, you do not need to go into quarantine as long as you're asymptomatic. So you can continue your regular activities, but you should contact your healthcare physician or healthcare worker to find out if you should be vaccinated. Because as the senator said, we actually have 2 vaccines, but we're only using one. We can talk about why. And we are trying to use vaccines both to protect people from getting Mpox to begin with, but also to protect people who have been exposed to Mpox. So I think I'll stop there to make sure we have plenty of time for questions, and really delighted to try to get to the bottom of any concerns or questions people may have.
No, thank you so much. That's Dr. Brewer, one of the top infectious disease physicians here in the state of California from UCLA. We are so grateful for his focus, his leadership all throughout this pandemic. We want to remind you, this is interactive. We want to hear from you tonight. We're taking your questions live this evening in this community conversation. Email us right now, senator.mcguire@senate.ca.gov. We're taking your questions, your comments, your concerns. Right now, senator.mcguire@senate.ca.gov. If you're watching via Facebook, simply drop your question, your comment, your criticism, your concern into the comment section. And of course, we're going to pick that up and get it onto the air this evening. I want to go first into a question from Jason. Dr. Brewer, again, over 100 questions tonight. Let's get right into it. A follow-up coming from Jason. If someone contracts coronavirus type 19 and Mpox, do we know of any serious medical consequences, health concerns, which may result of a double dip? I assume that means both Mpox as well as COVID. Talk about that, doctor.
So Jason, the answer is no. Likely there will be co-infections just because there's so much COVID-19 still in the community. So at people who are high risk for Mpox, it is certainly possible they could have both. But to our knowledge, they don't augment each other in any way, and they're very different viruses. So we wouldn't necessarily expect them to.
I'm going to go to our next question. This one is from Harla. Harla says, are there monkeypox cases in Santa Rosa? Yes, ma'am. We are seeing Mpox cases in Sonoma County. In fact, we're seeing Mpox in almost every county on the North Coast and throughout Northern California now. And she then goes on and asks, are there any symptoms besides lesion on the skin? I know you just went over that, Dr. Brewer, but go through those symptoms, please.
Sure. So the typical symptoms of Mpox usually are somewhere between 3 and 17 days after you've been exposed. If you've become infected, you'll develop usually some fever, some malaise. You may notice a sore throat, some swollen glands. The rash actually tends to develop 1 to 2 days after that. So people often feel, they feel like they have a cold or they don't feel right, and then they notice the rash. The rash will often start as just a little papule, a little red dot. It will then form into a blister. It'll umbilicate, which just means it gets a little divot in, and then eventually it'll crust over and resolve. Once that rash is completely gone, the person is no longer contagious. And as I mentioned, that can take up to about 4 weeks to happen.
So let's get into it, Dr. Brewer, about the spread of monkeypox, which we're calling Mpox here tonight. Just being candid, what we've seen is prolonged skin-to-skin contact. And in many cases, that could be through sexual activity. So would it be fair to say that prolonged contact is skin to skin is how individuals are getting the virus? And in many cases, not all, but in many cases, it's due to that prolonged sexual activity that we see throughout the community. Would that be a fair comment?
It is. The other way that monkeypox can spread is it can spread from contaminated linens or utensils. So, for example, monkeypox can get on a towel or on a sheet. And if those have not been washed, then that could spread as well. But that's probably much less common. Very importantly, we have no documentation of casual contact spread. So walking by somebody in a store, sitting next to somebody on an airplane, no evidence that that leads to spread of Mpox, and no evidence to suggest that it can be spread by talking, coughing, breathing, similar to what happens with SARS-CoV-2, the virus that causes COVID-19.
Michael writes in about Mpox and how cases are being tracked in such a way to identify the prevalence of cases. So, Dr. Brewer, as an infectious disease physician, the federal government, state government tracks cases, whether it's issues of COVID, of Mpox, you name the type of virus, whooping cough, they're tracking it. So walk us through how the government is tracking the spread of Mpox.
Sure. So Mpox is a reportable disease. So we don't actually track all infections, but there are a group of infections that are known as reportable diseases. What does that mean? That means that I, as a doctor, if I see a case that's a reportable disease, say, for example, tuberculosis, I'm not actually obligated to notify the Department of Public Health in Los Angeles County, which is where I am based. Likewise, any laboratory, any certified laboratory, if they have a positive test for a reportable disease like Mpox or tuberculosis, they too are obligated to report that information to the Department of Public Health. And that's actually how the department finds out most reportable diseases. It's through a positive test and then a reporting often done by a laboratory. But we need, the only way we know the cases are there is somehow they interact with the healthcare system, and then they're either reported by a healthcare provider or through a laboratory.
That's Dr. Brewer, one of the best infectious disease physicians here in the Golden State. He's from UCLA. We are grateful for his hard work. And we're taking your questions live tonight. We're going to get to Kevin's question on the Mpox virus in just a moment. But we want to remind you, send us your email. We want to hear from you tonight. Senator.mcguire@senate.ca.gov. We're taking your questions live this evening. Any questions that you may have on COVID, any questions that you may have on the Mpox virus, Dr. Brewer is here to be able to assist. It's senator.mcguire@senate.ca.gov. We're at a 734 strong watching this evening. Good evening. Thanks for joining us. We're going to go to another question on the Mpox virus, and then we're going to transition for a bit to the pandemic and COVID. Kevin writes in, can monkeypox only be transmitted by sexual contact, or should I be concerned if I'm not sexually active? I know you just went through that. That just came in. So, Dr. Brewer, why don't you hit that again in regards to the spread?
So Kevin, it's close physical contact. So that physical contact does not have to be sexual. It's much more likely to spread if you have broken skin or mucous membranes touch lesions. So if lesions are covered, spread is less likely to happen. Unbroken skin, less likely to become infected than if you have broken skin. But you can, as I said, also get it from contaminated towels, linens, or utensils.
We're going to transition, Dr. Brewer, over to COVID. Willis writes in, how soon can I get a booster after my positive case of COVID?
So the recommendation is, Willis, is to wait 90 days before you get your booster. If you do not have active COVID disease but have been previously vaccinated, the recommendation is after 2 months, then you can get the new booster.
We're going to go to Carol. Carol writes in, I'm 83 and I have all 4 shots and I just got over COVID. Can I get my COVID vaccine sooner when I get my flu shot? You just answered that, though, is she's probably going to need to get that flu shot first, Dr. Brewer, then wait 90 days to be able to get the COVID shot, correct?
That's exactly right. So definitely get your influenza shot, and they're actually becoming available now. And so certainly get your influenza shot. Then after 90 days, you will be able to get your COVID booster.
We're taking your questions live tonight with Dr. Brewer, an amazing infectious disease physician. We're going to go to our next question, comes in from Ann. I'm due for a COVID booster shot. My last one was 8 months ago. Which one should I get now? I'm a 75-year-old female with high blood pressure concerns. Should I get one for the new variant? Is Pfizer or Moderna better? Dr. Brewer, Ann asked that question. Fire away.
So Ann, at this point, the only booster anybody age 12 or older should be getting is a new bivalent booster, either the Pfizer or the Moderna. And really no evidence to suggest one is significantly better than the other. So either one is okay, but you should definitely be getting the bivalent one with the Omicron spike protein BA4, BA5 in it, not the original vaccine at this point for a booster.
Jeannie writes in to Dr. Brewer, my most recent booster was given in July of 2022. Do I need to get the new booster that was just released that protects against Omicron strain? Again, this is a common theme here tonight. She's 76 years old. So again, if she just got her shot, her latest booster in July, when should she get that next shot?
So depending on when in July you got it, then you're probably talking about either the end of this month or sometime in October, you'd be eligible to get the bivalent booster. So 2 months. So it just depends a little bit on when in July you got it. Should you get it? Yes, probably, because at 76, you are at higher risk for serious complications, would you, to get COVID-19? So I would recommend getting it after 2 months from your July vaccination.
So Dr. Brewer, Miranda writes in, if you just got a shingles vaccine and a rabies booster, should you immediately get that latest Moderna shot?
So no problem with mixing the vaccines. Not quite sure why you got a rabies booster unless you're a vet or you have some reason to
an angry animal around the house.
Right. To been exposed to rabies, but not a problem. In fact, you can get your COVID-19 booster and your influenza vaccine at the same time. They just should be in different arms.
Absolutely. So let's talk about how long that latest booster will work within the body. How long are you good, Dr. Brewer, until you need to go get another booster? So let's just say you get one of those new Moderna or Pfizer shots that's tailored towards the most recent variant. How long will that keep you boosted and healthy?
Sure. So we don't know for sure yet. We're still accumulating data, but it looks like the neutralizing antibodies fall off slowly as they did with the original vaccine. The really important thing to remember, though, is that the immune response is not just neutralizing antibodies. So one thing that we saw with the Omicron surge in the winter, this past winter, was a disconnect between number of cases and hospitalizations and deaths. And that was because while the vaccines were not necessarily preventing as well against infection, they were still preventing against serious disease, hospitalization, and death. And we would expect the new booster to continue to provide that long-term protection.
So again, one more time, let's just hit that hard here, Dr. Brewer. So you get this new shot, it's going to last you at least through the end of the year.
So at least through the end of the year, and probably much longer in terms of protecting you against serious disease, hospitalization, and death.
So there's been a lot of questions that have come in tonight is how soon before they do holiday travel should someone get that new booster shot? So if folks are traveling for the holidays, whether it's for Hanukkah or Christmas, how soon would you recommend, Dr. Brewer, them to get this latest shot before they get onto a plane?
So we estimate, based on the original vaccine trials, that you hit peak immunity about 2 weeks after you finish vaccination or after your booster. So if I were trying to time it, then I would say 2 weeks before I was going to go on my trip. However, that's what I would do if I were a young, healthy person. If I'm someone who's at high risk for serious complications from COVID-19, either because of my age or my underlying comorbidities, I have heart disease, I'm immunocompromised, I would get the booster as soon as I'm eligible. I would not wait to time it.
And again, if you're getting it sometime mid-September, into September, you think that that's going to last?
That's going to get you through the season, particularly for the things that we really worry about, which is the serious disease, the hospitalization, and the deaths. Definitely.
Yeah, and Dr. Brewer, one of the items that we've talked about in previous community meetings was the fact that this may become an annual booster, just like a flu shot. So, Dr. Brewer, I know you've been reluctant to be able to say that in previous, right? But it really seems like now, with the variants, at least for the coming few years, we're going to see a newly tailored booster shot to help prevent COVID. Am I mistaken in that?
No, in fact, the federal government announced earlier this week that we're likely going to annual COVID vaccination. And what we know from natural COVID coronavirus infections is that the immunity tends to, not surprising that we'll just go to an annual vaccination similar to what we do with influenza.
All right, let's see here. Linda writes in, what do you think our relationship to COVID will look like in the next few years? Thank you so much, Linda.
So Linda, this virus is incredibly well adapted for human-to-human transmission. It's not going away. It has not gone away since we started this pandemic. And so we're just going to have to recognize that it will be circulating in our community and taking the steps necessary to protect ourselves. What does that mean? Make sure you're up to date on your vaccinations and boosters. Make sure you stay home if you're feeling sick. If you're immunocompromised and you're going into settings where you might be exposed to people with COVID-19, consider wearing a mask, particularly when you're indoors, and then just make sure to wash your hands. And so the things that we've been doing for the last 2 years, we're going to continue to do as we go forward, but we're going to get on with our lives.
And I want to get to Henry's question about masking in a moment, but Dr. Brewer, so would it be fair to say what we're waiting for is for COVID to start fading out, right? Is that fair, or are we going to 10 years from now continue? And I know you're having to look in your crystal ball right now, but are we going to continue to take these boosters a decade from now, or do you think this is going to fade out? What's your prediction?
So no evidence to suggest that this is going to fade out at this time, any more than influenza ever faded out, right? So influenza continues to circulate every year. No reason to assume that SARS-CoV-2 won't continue to circulate every year. But hopefully what we're going to be able to do with our vaccines, with our public health measures, is we're really going to minimize the impact of COVID-19. So not that it's necessarily going to go away, but it's not going to be just so disruptive to our lives as it has been in the past.
We want to welcome each and every one of you to our community conversation. We're focusing on the COVID-19 pandemic along with the Monkeypox virus. We're with one of the best here tonight. We love him. His name is Dr. Brewer. We forgive him for being a Dodgers fan, even though we're in Giant territory. But we are truly grateful.
Actually, the Mets, but that's okay.
The hell, Dr. Brewer, the Mets. You're like the only Mets fan I know. All right, there we go. You're making the Mets proud here tonight. My goodness. All right. See, there we go. Hey, but we want to hear from each and every one of you. Senator.mcguire@senate.ca.gov. We're taking your questions live tonight. Of course, email us your comments, your criticisms, your concerns. Senator.mcguire@senate.ca.gov. If you'd like to join us on Facebook and you're watching us on Facebook tonight, simply drop your comment into the comment section. And of course, we'll get to that here lickety split. I want to go to Henry. Henry writes in and says, I'm going to a conference in a hotel in LA in October. No one I've spoken to is planning to wear a mask inside. I'm on one of the panels. I'm 75. I'm vaccinated, double boosted, and hope to get the new booster before I go. I'm in good health, but had open heart surgery 4 years ago. Should I be one of the few people wearing a mask while participating? I'll be honest, Dr. Brewer, I've gone to a few conferences. I am literally one, if it's a room of 100 people, there's probably 3 to 6 of us left wearing a mask. What is your guidance as we go into the fall and look at more folks going indoors?
Sure. So Henry, the bottom line is you need to do what's going to make you most comfortable and not worry about what other people think or say. The evidence is clear. Wearing a mask will reduce your risk of infection, and it will reduce it by about somewhere between 60 to 80%, depending on how well fit the mask is. So before vaccines, that took a risk of about 70% and lowered it down to about 3%. That having been said, the single most important thing you can do you've already done, which is get your vaccines, get your booster, get the new bivalent booster when you're eligible. So wearing a mask will help, but if you feel comfortable without your mask, then that's okay too.
So Dr. Brewer, so what are you going to do? Like, if you were 75, had open heart surgery, what would you do? And then,
sure.
As a physician, do you think, like, if you're on an airplane right now, would you wear a mask? What's your gut?
So I just spent last week, I spent 16 hours on a flight from Doha to Los Angeles nonstop, and I had a mask on, KN95 mask on for 16 hours.
Wow.
So I still wear a mask when I go to the grocery store, for example. I do not wear a mask when I'm outside. I do not wear a mask when I ride my bike or I walk my dog. If I were 75, had open heart surgery, if I were in a crowded conference, I probably would be wearing a mask, but that's my personal decision. And others may feel that it's not necessary, and that's not to say they're wrong and I'm right.
Absolutely. And Dr. Brewer, what we love about you, you're always upfront, honest, and sharing the truth. So thank you for that. I really appreciate it. Let's keep going, Dr. Brewer. We're getting a lot of questions coming in. Carol writes in, can I get a new COVID booster and a flu shot at the same time during the same appointment?
Yes.
Perfect. That's great. Let's go to Virginia. My spouse is a high-risk candidate for COVID-19. He's also a transplant recipient with medically suppressed immune system. What are the laws concerning reasonable accommodation requests in the workplace? How can I best protect my family when there's still a big risk for my spouse?
So I don't know about the laws. I'm not a legal expert, but the things that can be done is your spouse should be talking with their healthcare provider about whether or not they should be getting monoclonal antibodies. So we do give those to our immunocompromised patients every 6 months to try to protect them. Obviously, make sure you're up to date on your vaccines and your boosters, staying home if you're sick, and then probably wearing a mask when you're in indoor congregate settings.
I want to go back to a question on the Mpox virus. Thank you, Dr. Brewer. Coming in from Sigbrit. Sigbrit says, please stop traumatizing the public with these shenanigans. Why is there supposedly a medical emergency when the Mpox hardly has any cases in California or the United States? I mean, I got to be honest, Sigbrit, we got to learn from previous mistakes. We did not take the COVID, my opinion. This nation did not take the COVID-19 pandemic seriously in the beginning. And when it comes to infectious disease, the faster you get on it, the quicker that we're going to stop the spread. And that is why you're seeing states and especially big cities declare these emergencies to be able to rush assistance in both vaccinations as well as the personnel to be able to provide the shots. But Dr. Brewer, you're the infectious disease expert here. Why take Mpox so seriously?
Sure. So Ingrid, you're right in the sense that so the population of the United States is what? It's approximately 380 million people. We've had almost 95 million cases of COVID since the start of the pandemic. We've had 21,000 documented cases of Mpox that we know of. So big log order difference there. But a couple of things. One is, it's just not the total number. It's also, is this new and how quickly is it rising? So before March of this year, there had been fewer than 700 cases of known monkeypox in the entire world over a 20-year period. Wow. And all of a sudden, we have 51,000 cases since March of this year, right? So this is an explosion of Mpox, unprecedented. And while the total numbers are still very small relative to something like SARS-CoV-2, COVID-19, we don't want to see that 21,000 become 200,000 and then decide we need to do something about it. So as the senator said, the sooner you can contain an outbreak, usually the better off you are.
And candidly, Dr. Brewer, on the public health side, we should not allow these viruses to fester, right? I mean, that's what got us, again, there are differences, but that's what got us into the mess that we're in with COVID. I think with avian flu, right? We jumped on that quickly here in the United States to ensure that we didn't see significant spread. We got to get on it sooner rather than later, take it incredibly seriously, more work on the front end rather than the back. Correct, Dr. Brewer?
Exactly. I mean, while Mpox is not the severity that COVID-19 has been, it still causes substantial morbidity. So people who get it can be quite ill. It can be extremely painful. The rash can cause very painful ulcers. And so we certainly want to protect our population and prevent people from getting any illness if we can. And the sooner we get on this outbreak, the more likely we are to protect all of us from getting exposed to one of these pathogens.
That's Dr. Brewer from UCLA Medicine. We are so grateful that he's with us tonight. One of the top infectious disease physicians in the entire state of California. He's answering your questions on the Mpox virus. He's answering your questions, responding to your comments on COVID-19. Reminder, we'd love to hear from you this evening. We got a lot of questions. We're getting through them quickly tonight. And that's why we just wanted to spend time with Dr. Brewer this evening to be able to get as many questions answered as quickly as possible. And you never disappoint. Thank you so much for emailing us, senator.mcguire@senate.ca.gov. We want to hear from you live tonight, senator.mcguire@senate.ca.gov. We're going to go to Barbara's question. Barbara says, should we be getting the monkeypox vaccination? Who is eligible for it? Who needs it? Where can we get one? Does our doctor have to prescribe for us? Dr. Brewer.
So at this point, you can actually only get monkeypox vaccine through the Departments of Public Health. So they're targeting high-risk individuals. Who are those individuals? Those are individuals who have documented exposure to cases of monkeypox, and we can talk about what exposure means, and individuals who are at high risk for potentially getting Mpox. So that's people who work in labs with orthopox viruses. That's people who engage in sexual activity, particularly group sex and anonymous sex with multiple partners, people who've had sexually transmitted diseases in the last 2 to 6 months. So these are the groups that we're targeting right now with the vaccine. So no, it's not something you can just go to your local pharmacy and get at this point.
And be on the lookout. There are several organizations that are partnering with local public health offices for Mpox vaccination clinics. So, for example, in Marin County, the SPAR Center, they do fantastic work. They're partnering with Marin County Public Health. If you aren't following them on Twitter or on Facebook, you should do so. The SPAR Center in Marin County, they've hosted a couple of vaccination clinics. Humboldt County Public Health has hosted a couple of vaccination clinics. West County Community Services in Sonoma County has been partnering with Sonoma County Public Health for Mpox vaccination clinics, along with Santa Rosa Community Health. So be on the lookout for your local public health department or your community health center for those Mpox vaccination clinics. Dr. Brewer, we're going to go to Kelly. Kelly has a question about COVID. What does the doctor have to say about kids and long COVID? At what rate do they get it? How many of those kids get debilitated for life? Are kids in school getting monkeypox yet? Doctor, let's answer those COVID questions first, then let's go to Mpox.
Sure. So in terms of COVID, right now, about 1 in 8 people who has had COVID-19 will present with long COVID symptoms, and that's symptoms that tend to occur after 4 weeks from the acute infection. Most common manifestation is fatigue or what's called brain fog, trouble concentrating, particularly dealing with numbers, things like that. The evidence suggests that over time, the percentage of people with long COVID symptoms actually decreases. It doesn't increase, but we don't have good long-term data to know for those people whose symptoms have not improved, how long they will continue to have them. In general, kids are less likely to get long COVID than the adults because kids are more likely to have asymptomatic disease with SARS-CoV-2 virus, and severity of disease is associated with the likelihood of long COVID. My memory is that there have been under 10 cases in people under the age of 18 in California so far. So out of the 4,140 cases, I believe it's 9 were reported in people under the age of 18.
Thank you so much, Dr. Brewer. Thank you, Kelly, for your questions here tonight. I want to get to Linda's comments. When would California begin seasonal public service announcements reminding folks to get flu and coronavirus booster shots? That started. We are encouraging folks to be able to get the flu shot. If you are a member, if your healthcare home is at a community health center or at a Sutter or Providence or a Kaiser, they are sending out constant reminders right now when it comes to the flu virus. In addition, you're going to see a really big push by the state, a big push by the feds and healthcare providers about the newly tailored COVID-19 vaccine shot. That new shot, as we heard from Dr. Brewer, is tailored towards those virus strands that are actively in the community now. So you're going to see a ramp up of that as we enter into the fall months. And again, Dr. Brewer, same cautionary tale as we've been saying over the last 2 years. As we enter fall and winter, are we going to see that similar spike as we've seen, probably not as severe, but see a spike as we enter into the holiday and winter months?
I think that's very likely. So these are SARS-CoV-2 is a coronavirus. It's a respiratory virus. We know that respiratory viruses tend to increase in circulation at low temperatures and low humidities. And we know that indoor transmission is responsible for most cases, and people spend more time indoors in the winter months. I think the big difference between the first winter and the second winter was, even though we had substantially more cases with the Omicron surge, we were at one point averaging about 800,000 cases a day, whereas with Delta, we peaked around 250,000 cases a day, with fewer hospitalizations and deaths per number of cases. And that's because of the vaccine. So make sure you're vaccinated, make sure you get your booster, and do get your flu shot.
I want to get to another question on the Mpox virus. This is coming in from Shirley. How does monkeypox impact those with the autoimmune diseases? Dr. Brewer.
So people who are immunocompromised are more likely to have disseminated disease. So what that tends to mean is they're more likely to have widespread lesions of their skin, and they may have what's called visceral disease, which means they could have hepatitis or encephalitis. We have not seen a lot of cases in immunocompromised individuals as yet. 41% of people who have had documented Mpox in the United States are HIV co-infected, but the vast majority of them are on antiretroviral therapy, and they have not had more severe disease than people who have not been HIV infected. But if you're HIV infected and you're not on antiretroviral disease, therapy, then you probably are more at risk for serious disseminated disease.
That is Dr. Brewer, one of the top infectious disease physicians in the state of California, answering your questions tonight. Betsy wrote in at senator.mcguire@senate.ca.gov. Betsy just wrote in, how frequently should we get the COVID boosters? I had my second in June before a trip. I'm 71, healthy, good, wearing masks. Again, this is a frequent question here tonight. Dr. Brewer's, how frequently should folks get it? And then especially with this new shot coming out.
Sure. So Betsy, you should be getting your bivalent vaccination now because it's been at least 2 months. And then likely we'll be going to an annual vaccination. So probably after this booster, your next booster will be in the fall of 2023. But certainly you're eligible for and should get a bivalent booster at this time. So a booster with the new 2-strain vaccine that's now available.
So Dr. Brewer, if we're going to that annual booster shot, and we're only going to do that once a year, does that mean that the shot is stronger than what we're receiving now, so that will take us longer? Explain that to us.
Sure. So what it probably means is that what we're seeing is that the protection against serious disease is more long-term than the protection against infection. So what happened with Omicron was able to infect people who had been vaccinated or previously infected. We call that immune escape. But people who had been vaccinated or previously infected still were protected more than people who had not been vaccinated or previously infected against serious outcomes. So that underlying immune protection against bad outcomes, such as hospitalization, that's lasting much longer after vaccination than protection against infection. And so that's what we're really worried about. And that's why we'll probably be able to get by with a booster once a year.
That's a really great explanation. I want to get to Kimberly, who just wrote in here tonight. Kimberly, it's really good to hear from you. Thank you so much for tuning in. Why is there only a 1/5 dose per Mpox vaccine? How much protection does that really offer? Does it prevent transmission or lessen symptoms? And for how long? So, Dr. Brewer, let's give a little bit of background on that. The federal government is allowing a vaccine that is less than what would typically be given to ensure that we don't have a shortage here in California and throughout other states. So it's not as strong a dose, again, my layman's terms. So Dr. Brewer, get into it about what the federal government has done and really how much protection does it provide folks against Mpox?
Sure. So So there are actually two vaccines, the Jynneos vaccine, which is the one we're talking about, and then there's actually another vaccine, a smallpox vaccine called ACAM 2000. We're going to put that to the side because we're not using that one right now. So the Jynneos vaccine, normally you give a half cc dose subcutaneously. However, there's a study from about 5 years ago to show that if you give a 1/5 dose, so a 0.1 milliliter dose intradermally instead of subcutaneously, you get a similar immune response when you measure neutralizing antibodies. So that's the data that we're using to say it's okay to give that smaller dose. This is something similar to what the World Health Organization did when there was an outbreak of yellow fever in Namibia, and there was a global shortage of yellow fever vaccine. So they did exactly the same thing, is they gave a smaller dose by a different route, and it seemed to work just fine. So we're just recognizing the fact that we have a shortage of this new vaccine, and we're trying to make it go stretch it as far as we can while still protect people.
So then when will that individual need to go back in for a second dose?
So you get your second dose 28 days later. So the Jynneos vaccine is a 2-dose vaccine, just like the COVID-19 vaccine. So you get your first dose on day 1, and then you get your second dose on day 28. And we assume that you're protected starting about 7 days after your second dose. The other thing that the vaccines can do if you're exposed, if you get vaccinated within 4 days of exposure, there's good evidence to suggest that it will protect you from becoming infected. We call that post-exposure prophylaxis. If you get it between 4 and 14 days after you're exposed, it doesn't necessarily reduce the risk of infection, but it does seem to reduce the risk of serious disease. So if you're exposed to somebody with Mpox, definitely reach out to your public health department or your healthcare provider to find out if you should be vaccinated.
Dr. Brewer, that's a great explanation. We have about 5 more minutes left. We're going to do a last call for questions, comments, concerns. Email us right now, senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. We're over 700 strong sticking with us here this evening. We're so happy that you're with us to be able to hear from the good doctor, Dr. Brewer, one of the top infectious disease physicians. He's joining us. He's a proud Mets fan here tonight, and he's coming to us live from UCLA and in Los Angeles. We're going to go to our next question here, Dr. Brewer. Dr. Brewer, I apologize. I know you've talked about this a lot, but we're getting a lot of questions about the new booster. So, folks are coming in and out watching. So hit it hard, Dr. Brewer. Tell us, number one, about the new booster. Tell us how long this new booster is going to last, what it's good for, and finally, can you get your booster with your flu shot? Because we're getting a lot of repeat questions. I get it, but we want to make sure we get the information out repeatedly.
Sure. So the new booster is different from the previous vaccine in that it contains the mRNA, the code for 2 spike proteins instead of 1. It contains the original spike protein code and the code for the Omicron BA.4/5 variants that are currently circulating in the United States. And those variants account for 99% of all the COVID in the country. So it has those 2 components instead of 1. You can get that vaccine anytime if you're age 12 or older, as long as it's been at least 2 months since your last vaccine or 90 days since you were infected with COVID-19. So at any point, if you're 12 and older, you can go get that booster, and you can get the booster, the COVID booster, at the same time as your influenza shot, just get them in different arms.
That's really great news. And again, stick with, so if you've had, for example, 2 or 3 boosters with Pfizer, 2 or 3 boosters with Moderna, does it matter who you go with?
Does not matter at all. You can get Pfizer or Moderna. The only thing where you should stick with the same one is if it's your primary vaccination. So if you have never been vaccinated, you're getting vaccinated for the first time with either Pfizer or Moderna, then yes, you want your 2 doses to both be Pfizer or your 2 doses to both be Moderna. But in terms of boosters, does not matter. You can get Pfizer or Moderna. The only difference is Pfizer, you can get if you're 12 or older. Moderna is only authorized for people 18 and older. So if you're between the ages of 12 and 18, you need to get the Pfizer, not the Moderna.
Straight talk from Dr. Brewer. Thank you so much, Dr. Brewer. I want to go to, we have a few more questions, time for a few more questions here this evening. I'm sorry we're not able to get to every one of you. We are so grateful that you emailed in here tonight, provided comments. We really appreciate you tuning in. We want to go to a few more. Marissa writes in, when will things be COVID-19 free enough for the large swath of Marin senior citizens to feel safe going out without a mask? Dr. Brewer.
So I think some seniors feel that way now. So that's just going to be a personal decision. I can't tell you when you're going to feel safe enough. What I can tell you is that if you're vaccinated, you got your booster, you're maintaining your physical distancing when you're out, then it's really just up to your own individual comfort level as to whether or not you think adding a mask to that helps. But it's a personal decision. The single most important thing is the vaccine, the boosters.
But like we heard from Dr. Brewer earlier this evening, he just came back from a trip. He wore that mask the entire time that he was on the airplane. And if there is going to be a crowded situation that you're going to be in, whether you're going to a show or to a conference, Dr. Brewer said to us, he most likely would wear a mask into that. It's his own personal comfort, but take it from a medical professional. He didn't say this; these are my words. Better be safe than sorry, right? Better be safe than sorry.
But the bottom line is it is a personal decision.
But like Dr. Brewer, so let's talk about that a little bit, though. So what we've been told for the last 2.5 years is someone's coughing or sneezing near you, you're going to get the particles and you can get COVID. So if we still have COVID in the community and you're in a crowded situation or on an airplane.
Yeah, masks work, right? So masks work, right? So if you're coughing and sneezing, you should be home, okay? You should not be in crowded situations. You should not be on airplanes. If you're sick, please stay home. If you do have to go out and you're sick, then please definitely wear a mask because that will reduce the virus particles you spread to others, whether it's SARS-CoV-2 or adenovirus or whatever. If you're at all concerned about your own personal risk because of your age, comorbidity, anything else, then please, by all means, wear a mask. It is not harmful and they do help. Just make sure it's a well-fitted surgical mask or a N95 respirator.
Jennifer writes in, she has a very personal question for you, Dr. Brewer. Jennifer writes in, did you take your mask off while you ate on the airplane?
I did because I cannot eat through my mask.
That's true. But you felt comfortable enough though, right? I mean, are you still going by the 15-minute rule of exposure or are we past that now?
So Jennifer, I was sitting next to my son and I had an aisle next to me. And if Boeing is to be believed, because of the laminar flow of the planes, they substantially reduce the risk of person-to-person spread. I thought it was fine to take off my mask while I was eating and drinking. However, I can tell you that sitting on a plane in economy for 16 hours is not comfortable, and wearing an N95 respirator made it less so.
So not only could you not breathe, your knees are still hurting.
Right.
All right. All right, Dr. Brewer, that's great. I want to go to our last question here tonight. And this is coming in from Cameron. Where can I get, if I'm exposed, where can I get an Mpox vaccine? Again, I think you've hit that hard, either a community health center, your local public health, but probably best thing to do is Google your public health department and then call that anonymous 800 number. But I don't want to put words in your mouth, Dr.
No, that's exactly right. So the public health departments are still deciding who is eligible for vaccination at this point. So you definitely want to reach out to them or your healthcare provider to have them reach out to the public health department. But the critical thing is you want to do it sooner rather than later. So if you think you've been exposed or you're in a high-risk group, and right now that's men who have sex with men who have had sexually transmitted diseases, who are HIV infected, who have had anonymous or group sex or sex in a commercial setting, these are the populations that we're targeting for vaccination right now. If you fall within those groups, please reach out to your healthcare provider or the local public health department.
I don't say this about everyone, but I got to say, Dr. Brewer, you are truly one of the best. We can't say thank you enough. You have made yourself available for a few dozen evenings during the pandemic. And I cannot tell you how many folks have come up to me and have been so incredibly grateful to be able to hear your calming voice, to be able to provide accurate and timely information. Countless folks were able to get through the pandemic because of your guidance. And I just want to say thank you. And I know we're going to continue having Dr. Brewer on with us as COVID continues to evolve. And of course, with Mpox as well. But I think the world of you, Dr. Brewer. You are just one of the best. I want to give you closing comments here tonight, Dr. Brewer. Give us your crystal ball for the winter, what folks should be doing in regards to COVID, and then any closing comments in regards to the Mpox virus. And again, love having you, sir. It's great to see you. I'm going to give you the final word, and then I'm going to do a few thank yous.
Sure. So first off, my pleasure, and anytime I can help, please feel free to reach out. In terms of COVID-19, really straightforward. Make sure you're vaccinated. If you're eligible for a booster, please go out and get the new bivalent booster, that two strain dose, and stay home if you get sick this winter. Good hand hygiene. And please do not be concerned about wearing a mask if it makes you feel better. The evidence is clear. Masks do work. So please feel free to wear a mask if you want. In terms of Mpox, right now it still is primarily confined to populations, a small minority population where there has been a lot of close, intimate physical contact. So if you're an individual, particularly right now, men who have sex with men, who have had a sexually transmitted disease, is HIV infected, or has engaged in group sex or sex in a commercial setting like a bathhouse, please reach out to your public health department or healthcare provider about getting vaccinated. If you think you may have Mpox, and also please reach out to your public health department or healthcare provider, because we do have treatments available. But finally, this is a disease that is spread by physical contact. It has nothing to do with gender identification or sexual orientation. It has to do with behaviors. And so please, let's not stigmatize any members of our community. Like all outbreaks, we're in this together, and we need to help and support each other.
That is Dr. Brewer. Dr. Brewer is from the UCLA School of Medicine. He's been with us from the very beginning. He'll continue to be with us as we move forward in the months to come. Dr. Brewer, you are the absolute best. Thank you so much for joining us. We want to remind folks, if you have any questions, concerns, you can email us, senator.mcguire@senate.ca.gov. You can call us 916-651-4664. 4002, or simply message us on Facebook and or Twitter, and we'll make sure and get back to you ASAP. A few thank yous here this evening. We want to say thank you so much to Carrie. We want to say thank you to Abby and to Kai. Thank you so much to Lyles as well as Rich, who helped put tonight together. We're so appreciative. And finally, just want to say thanks to each and every one of you. We are still over 700 strong tuning in tonight on this community conversation on the COVID-19 pandemic, as well as the Mpox virus. We hope you're able to get important information that you can share with your friends, families, and neighbors. And I'm just going to end it right here. Stay strong, North Coast. Grateful to be with you. And cooler temperatures are finally on the damn way, Dr. Brewer. Looks like this heat wave will be breaking over the weekend. I don't know about you, Dr. Brewer, but typical September temperatures could get up in the high 90s. It hit 120 in communities here earlier this week. It's just been devastating. Dr. Brewer, down south, how about you?
We're a little blessed because we're closer to the coast. But the inlands, it's been brutal too. Yeah, I'm just hoping that everybody stays cool. And please remember that there is a health advisory when the heat is this hot. So cut back on your outdoor activities. Try to stay indoors. Try to keep cool, keep up with your fluids.
Well said, Dr. Brewer. Thank you so much for joining us. We're grateful you're with us. Again, stay strong, North Coast. We'll talk to you soon. Thank you so much.
Bye.